Basic Safety in the Immunology Serology Laboratory. Here are your learning objectives. All right, so we have some agencies for safety regulations and practices. The first one is OSHA, which is the Occupational Safety and Health Administration. CLSI, which is Clinical and Laboratory Standards Institute. CDC, which is the Centers for Disease Control and Prevention. CAP, which is the College of American Pathologists. And TJC, which is the Joint Commission. For laboratory safety, we have handling of infectious specimens. So we would want to wear our personal protective equipment, or our PPE. So the staff must wear laboratory coats when working in the lab. And additional protections should be used to prevent contamination from infectious agents. There are food and drink restrictions as well. So eating or drinking is prohibited in the laboratory work areas. Food and drink must not be stored in the same area where specimens are kept. So don't keep it in the refrigerator where you have specimens. Keep it in your break room refrigerator. That is okay. And then biohazard labeling. So any containers, refrigerators, or freezers that are used to store specimens must be clearly labeled as containing a biohazard. So usually you'll see, that bright orange sticker, the biohazard sticker on the refrigerator. And that's one way to know that there are specimens in there. For centrifugation safety, so specimens that require centrifugation must be capped before processing. They should be placed in a centrifuge equipped with a sealed dome to prevent the release of the aerosols or contaminants into the air. For opening rubber-stopped tubes, use a gauze square when opening rubber-stopped tubes. This can help minimize the production of aerosols, which can actually spread infectious agents. For pipetting, there are some safe practices that you can use. First one would be to use autodiluters or a safety bulb when pipetting liquids. And just remember, mouth pipetting of clinical material is strictly prohibited due to the high risk of exposure to infectious substances. Yes, that is a thing people used to do. Some national patient safety goals. We have the correct patient identification, and this helps to ensure accurate identification of patients before collecting, labeling, or processing of their specimens. Proper identification helps prevent specimen mix-ups and diagnostic errors. For improved staff communication, we maintain clear and effective communication among laboratory staff. So good communication can help reduce mistakes, improve workflow, and actually enhance patient safety. For safe work practices for infection control, so the definition of standard precautions is they are an infection control approach used to prevent occupational exposure to bloodborne pathogens. Handling of these specimens, so essentially what that states is all specimens and samples must be treated as potentially infectious. So you're going to assume specimens may contain pathogens such as HIV, hepatitis B, or any other bloodborne microorganisms. To ensure safe work practices, we're going to educate and train all healthcare workers on standard precautions. Training should include methods for preventing bloodborne infections and safe handling of clinical materials. We're going to want to talk about proper equipment and supplies as well. So we want to ensure the availability of appropriate protective equipment and necessary supplies. Some of those supplies example would be like gloves, lab coats, masks, having a safe disposal container, like the hard containers to put needles and stuff in. We're also going to want to monitor compliance. So regularly monitor staff compliance with established biosafety and protective policies. Monitoring can help ensure that safety protocols are consistently followed. So personal protective equipment, or PPE program, we would have a workplace hazard assessment. So we would conduct a workplace hazard assessment, and that would identify potential risks. We're going to maintain a written hazard certification documenting the assessment. We're going to have proper equipment selection. So we're going to select appropriate protective equipment based on identified hazards. So depending on what you're working on in your lab will equate to what type of equipment you need in the lab. This ensures equipment effectively reduces exposure to workplace risk. Once again, we're going to have employee information and training, so provide employees with information and training on safety procedures. And once again, we're going to maintain that written competency certification, confirming that employees understand and can apply safety practices. For a regular hazard reassessment, so we're going to periodically reassess workplace hazards to identify new or any changing risk. And then we're going to update the safety procedures and equipment as needed. For protective infection control techniques, so we're going to have the selection and use of gloves. So the use of sterile gloves must be used for procedures involving contact with normally sterile areas of the body. They are also required during procedures where sterility has already been established and must be maintained. The use of non-sterile examination gloves are used for procedures that do not require sterile gloves. So an example of that would be like a phlebotomy procedure. Changing gloves, so gloves must be changed between each patient contact, and that helps to prevent cross-contamination between patients. Gloves must be worn when processing blood specimens, reagents, or blood products to reduce exposure to potentially infectious materials. Changing of gloves, so the gloves should be changed frequently during laboratory work, and they must be changed immediately if they become physically damaged or visibly contaminated with blood or other body fluids. Reuse of gloves, so latex or vinyl gloves must not be washed or disinfected for reuse. And because washing with the detergents may actually increase the penetration of liquids through small or undetected holes in the gloves. This is just a picture showing you from the World Health Organization, or the WHO, on how to properly remove your gloves. So protective infection control techniques, once again, we have a facial barrier protection that could be used, like mask or face shield or even goggles, and it should be used to protect the eyes, nose, and mouth from exposure to infectious materials or splashes. Occlusive bandages should be applied to cover cuts, abrasions, or any broken skin, and that will also help to prevent exposure to contaminants. Your laboratory coat or gown should be worn as a barrier protection to prevent contamination of clothing and skin when handling specimens or hazardous materials. Hand hygiene in the lab. So after laboratory work, we're going to wash hands after completing that lab work and before leaving the laboratory to remove any potential contaminants. After removing gloves, hands must be washed immediately after removing gloves, as gloves may have small tears or contamination. And we're also going to perform hand hygiene before other certain activities. So we're going to wash our hands before eating, drinking, changing your contact lenses, or using the restroom. Before contact with sensitive areas, so you're going to perform that hand hygiene before activities that could involve contact with mucous membranes or broken skin. And after accidental contact, so we're going to immediately wash hands after accidental skin contact with blood, body fluids, or tissues. To practice hand hygiene, so the proper hand decontamination procedure, so using hand sanitizer actually will decontaminate hands with hand sanitizer following the manufacturer's instructions for effective use. You can usually find that on the back of the bottle, and it will tell you how long you need to rub your hands for and stuff like that. Each one's a little different, so make sure you look so you know what you're supposed to be doing. All right, and then washing hands with soap. So you're going to wash hands thoroughly with either non-antimicrobial or antimicrobial soap for at least 20 seconds. After washing, we're going to rinse hands well and dry with a disposable towel. So using a disposable towel to turn off the faucet can actually help to avoid recontaminating your clean hands. Some other safety practices in the lab, so nail care. We want to make sure we keep our nails no longer than 1/4 inch beyond the fingertip. Short nails actually help reduce the risk of harboring pathogens and can prevent glove tears. For footwear, we want to wear rubbered-soled shoes that cover the entire foot and provides protection against spills, sharps, and other laboratory hazards. For electronic devices, they should not be exposed to potential sources of infectious contamination, and this would help prevent cross-contamination and damage to sensitive equipment. For decontamination of work surfaces, equipment, and spills, we're going to wear gloves when handling cleaning agents or contaminated surfaces to protect your hands from chemicals and pathogens. The decontamination solution, a lot of times you can use a 1 to 10 diluted free chlorine solution to decontaminate laboratory surfaces effectively. For our cleaning schedule, we're going to clean and sanitize work areas at the beginning and end of each shift to help maintain a safe and hygienic laboratory environment. And a lot of times labs will have checklists for you to make sure that you remember and document that you actually did these things. So for spills, we're going to have personal protection. We're going to wear our gloves, our lab coat, and face protection when handling any spills, and this will help prevent exposure to infectious materials. For the initial spill control, we're going to absorb blood or body fluids with disposable towels to help try to contain the spill. For a disinfectant, you can clean the spill site with a 1 to 10 chlorine solution to remove all visible blood, and wipe down the area with paper towels soaked in the same 1 to 10 chlorine solution to ensure thorough disinfection. We're going to place all disposable materials used for decontamination into a biohazard container for safe disposal. For disposal of infectious laboratory waste, so we do have regulatory compliance that we have to follow. So we would follow OSHA, FDA, and all applicable federal, state, and local regulations regarding laboratory waste disposal. So adhering to legal and regulatory requirements ensures safe handling and disposal of hazardous and biohazardous waste, protecting both laboratory personnel and the environment. The definition of infectious waste, so according to OSHA, infectious waste includes blood and blood products, contaminated sharps, so like needles and scalpels, pathologic waste like tissues and organs, microbiological waste, so like cultures, stocks, or infectious agents. For disposal of these containers, they must be conspicuously marked with the biohazard symbol. Usually that color is orange, black, and black or red. We want to put them in a rigid, leak-proof, and puncture-resistant container to prevent spills and injuries. For the final decontamination of this infectious waste, we're going to have incineration. This is actually the preferred method for final disposal of infectious waste. It will effectively destroy all infectious agents and reduces waste volume. Autoclaving is an alternative method, and it is a terminal sterilization that uses the autoclave. Autoclaving uses high-pressure steam to sterilize infectious materials before disposal. Healthcare personnel are typically required to be immunized against hepatitis B, influenza, measles, mumps, rubella, varicella, and there are some additional recommended immunizations, and this is depending on risk factors and workplace requirements. But other immunizations may include hepatitis A, diphtheria, pneumococcal disease, and tetanus. So maintaining up-to-date immunizations protect healthcare workers from infectious diseases and prevents transmission to patients and colleagues.